Good afternoon and welcome to the Midday News. Here's what we have in the bulletin. Controversial leader Dr. Kevin Smith is dead. Regarding the regulation of churches by the government. And later in sports, reggae girls hoping for local camp ahead of World Cup qualifiers next year. I'm Anthony Lugg. Here are the details. We begin with the news that controversial leader Dr. Kevin Smith is dead. He was involved in a major accident near the Bogwalk Gorge in St. Catherine this morning. Reports are that Smith was being transported to Kingston when the incident took place. Smith has been in the news for the past few days following the ritualized killing of two people at his church in Albion, St. James. A policeman also died in the three-vehicle collision which occurred around 9:30. For the latest on this developing story, we now join our reporter Kirk Wright, who's on location. Kirk, what can you tell us?
Constable, who it said was transporting the pastor to Kingston to be formally charged. We understand from Stephanie Lindsay that somewhere about 9:30, while they were taking him into Kingston, there was an accident. They're not sure how the accident happened, but the car got in an accident, and the car crashed. The officer, three officers, two are now critical in the Spanish Hospital. One succumbed to his injuries. But still, Stephanie says it's too early for her to say how the accident happened. The pastor, as we said before, was being transported to Kingston to be formally charged by the police, by the MID.
Mood at the hospital
I'm
there. In terms of the mood of the hospital there, are there any supporters? What can you tell us in terms of that?
So far, after the news emerged that the pastor had died, several persons converged on the Spanish Hospital. Essentially, they thought the pastor was here because that's what they have been hearing on the ground, that the pastor was dead. And so lots of people came here. We had some members of the High Command also converge on the hospital to, I suppose it's because the police officers were involved. But the people have been, saying that they are kind of relieved that this had happened, and not that they're happy that the pastor had passed, but based on the nature of what was said about him, some people said that they were relieved, and so now some people can get their lives back together.
And Kirk, in terms of why were they on the Bogwalk Gorge and not the north-south highway, have you gotten any reports as to why they were taking that route?
So we did ask Stephanie Lindsay why not take the shorter, safer route into Kingston, and she did say that the police officers who were transporting the pastor made that assessment and decided that that's where they would have driven. It still baffles us as to why not take that route, but she says the investigation will commence shortly.
All right. Thank you, Kirk. Thank you very much for that, and we will be providing you with more updates as it becomes available. And TVJ News has been informed that a senior member of the Jamaica Defense Force is under investigation for his alleged role in the operations of the Pathways International Kingdom Restoration Ministries in Montego Bay, St. James. Sources told our news team that the officer, a captain, was placed in military confinement after his photograph was allegedly found inside the church last week. Vashon Brown has that angle.
It's reported that the Jamaica Defense Force commenced an investigation after reviewing videos with the leader of the controversial organization, Kevin Smith. In the videos, which have been circulating on social media, a photograph of the JDF captain and his wife were seen placed in a chair behind Mr. Smith on the pulpit. It's understood that the soldier is being questioned to ascertain whether he's a senior member of the church. TVJ News was informed that Mr. Smith was questioned last weekend by detectives attached to the Major Investigation Division who are probing the deaths of 2 congregants last week. Mr. Smith was taken into custody on Sunday after the police stormed the church based in Albion Meadows following reports that congregants were being killed as part of a religious ritual. 39-year-old Tanika Gardner and an unidentified man were found dead in the church. Their throats were slashed. 14 children who were found among the congregants are now in state care. Vashon Brown, TVJ News.
Meanwhile, calls continue for the regulation of churches island-wide following the death of 2 congregants at the Pathways International Kingdom Restoration Ministries in Montego Bay 2 weeks ago. However, there are varying views from the church leadership. Our reporter Shane Masters has this report.
Following the ritualized killings of 2 people at the Pathways International Kingdom Restoration Ministries, questions continue to be raised about how easy it is to start a religious group across the island. It's why President of the Independent Churches of Jamaica, Bishop Neville Owens, last week told TVJ News that the government should regulate the country's religious sector.
The government has a responsibility to govern in all spheres pertaining to justice, equity, the law. And so it may come to that.
But former General Secretary of the Jamaica Council of Churches and moderator of the United Church in Jamaica and Cayman, Reverend Gary Harriet, says while he is concerned about the free-for-all nature in setting up a church, such a decision cannot be left up to the government.
I would rather the church leadership sit down and to think through this matter and then to have a common position, then we can then approach the government. But I wouldn't want to give government any kind of instruction now because you also have to be careful. You don't want a situation where government manipulates or takes control of the religious space. That's a day, so you have to watch that as well.
Incoming president of the Jamaica Baptist Union, Reverend Dr. Glenroy Layla, says the concept of separation of church and state must be maintained.
We need to be looking at some way of how you recognize churches, how you recognize leaders in churches. I'm also mindful of the fact, though, that in some communities we have persons who are faithful Christian leaders who do not necessarily have the formal training that some other people have, and who reflect what the church, in my mind, is supposed to be. So we also have to be careful of that as well, that we don't have a kind of system that, just make some people because they don't necessarily have certain qualifications not to be able to be recognized. So,
Reverend Layla was speaking yesterday on Radio Jamaica's weekly news review program. That's a wrap. Shane Masters, TVJ News.
To other news now, the Jamaica Council for Persons with Disabilities and the Ministry of Health are planning to establish vaccination sites for people living with disabilities. This as part of efforts to get some of the most vulnerable vaccinated against the COVID-19 virus. Sandy Williams reports.
Several vaccination sites across Jamaica, but none designated for people living with disabilities. Therefore, it's unclear how many people from the disabled community have actually received the COVID-19 vaccine. Executive Director at the Jamaica Council for Persons with Disabilities, Dr. Christine Hendricks, says scores of disabled people have taken the jab.
Persons with disabilities are getting vaccinated through the varying sites that are available. Of course, you do have some, like every other Jamaican, who may not believe that they need to be vaccinated, or but a number of persons with disabilities are being vaccinated.
She says while there are others who have not yet been inoculated, some have been reaching out to the council for assistance.
Several groups of parents or schools with students who want to get back to face-to-face have asked us to reach out to the Ministry of Health so that they can facilitate understanding for the parents to help them make that decision, and for some, the need to have the Ministry of Health come in and do vaccination.
Dr. Hendricks adds that plans are underway for established vaccination sites designated for people living with disabilities. This is part of efforts to get as much people from the disabled community vaccinated. People living with disabilities are considered vulnerable, and according to Dr. Hendricks, some are more vulnerable than others.
The Ministry of Health has agreed to facilitate the students, the schools when they are ready. So where we are now in the process is awaiting that information from the schools to pass over to the Ministry of Health so they can facilitate the process.
The government recently announced the start of a house-to-house vaccination program, which is intended to take the vaccines to communities that are not close to a fixed site and to persons who are not able to travel to these sites. 9 health departments ranging from Hanover, Manchester, St. Elizabeth, Trelawney, Westmoreland, St. Anne, St. Mary, Portland, and St. Thomas have deployed healthcare teams to communities to administer the COVID-19 vaccines to some of the most vulnerable, including the disabled. Sandy Williams, TVJ News.
And it's time now for a break, but stay with us. More stories when we return. Welcome back to the Midday News, and thanks for staying with us. We go now to reactions to yesterday's announcement by the Ministry of Health that it will begin house-to-house vaccination for some groups. The president of the Nurses Association believes there will be some challenges. More in this report.
The house-to-house vaccination program is intended to make the COVID-19 vaccine more accessible to challenged groups. But already there are concerns. President of the Nurses Association of Jamaica, Patsy Edwards-Henry, believes a longer waiting time will affect the efficiency of the process.
You're going to have to spend more time at any one area. So it's not like going into a community and getting a group of persons together where you can do, say, a batch. Going house to house is going to sort of slow down work.
The government has been finding it difficult to get persons to take the jab. And despite the vaccines now being brought to the doorsteps of Jamaicans, Mrs. Edwards-Henry believes the challenge still remains.
We will have a number of persons who, because of the hesitancy and the challenges and the stories, they will still refuse to take the vaccine.
In the meantime, the NAJ president has also responded to concerns about vaccine hesitancy among some healthcare workers.
Nurses are pro-vaccine. They have their hesitancy because of a number of reasons, and a survey was done, and as we speak, we are working not only with the nurses, but we are working with different groups to roll out programs based on the comments that were made.
According to the NAJ president, some 67% of nurses have received the vaccine. She was speaking on the morning agenda on Power 106. Herman Green.
Health Minister Dr. Christopher Tufton has responded to news that some 400,000 doses of the Pfizer vaccine are expected to arrive in the island before the middle of November. Our news center has been reliably informed that the U.S. government has decided to consolidate its donation of the Pfizer COVID vaccine to Jamaica, and a decision has been made to send a single large donation to Jamaica.
I'm not at liberty to give any specific details. Beyond that, we anticipate some confirmation. The final arrangements are being made. And again, like the other issues, we will comment when we have the final details on that.
172 people have tested positive for COVID-19 in the last 24 hours. This has increased the overall case count to 88,431. The positivity rate is 14.7%. According to the Ministry of Health, 334 people are hospitalized with the virus. 22 patients are in critical condition, while 37 are severely ill. 172 people have recovered from the respiratory illness, pushing the overall recovery count to 56,761. There are 28,888 active cases on the island. Meanwhile, 4 people have died between October 19 and October 22. The death toll now stands at 2,183. 2 deaths are under investigation. And it's time now for the Business Minute. Here's O'Shane Masters.
The International Monetary Fund, IMF, says the economic impact of the COVID-19 pandemic appears to be receding in many parts of Latin America and the Caribbean. Acting Director of the IMF's Western Hemisphere Department, Nigel Chalk, says the regional economic outlook has been revised upwards.
We now expect the region to grow by 6.3% in 2021 and by 3% in 2022. There's clearly a lot of uncertainty associated with the outlook, both related to the pandemic and to variants, but also surrounding the speed and the timing of the return of private demand as policy support in the region is scaled back. Given these uncertainties, countries should prepare for this recovery not to be a linear path.
And the Digicel Group has entered into an agreement to sell Digicel Pacific to a subsidiary of Australian telecommunications company, Telstra Corporation. The deal has been valued at $1.85 billion. A statement yesterday from Digicel said the transaction, which remains subject to customary government and regulatory approvals, is expected to be completed in the first quarter of 2022. Digicel Pacific runs in 6 markets in the South Pacific, including Papua New Guinea, Fiji, Samoa, and Tonga. When the deal is finished, Digicel will have no operational responsibility for the Pacific operations, though it will provide customary transition services for a short period. And that's it for the Business Minute. I'm O'Shane Masters.
It's now time for the top regional and international stories. Here's Sandy Williams.
In the region, a senior official of the International Monetary Fund, IMF, says the first economic policy for Caribbean countries hard hit by the coronavirus is to improve health conditions. Acting Director in the IMF's Western Hemisphere Department, Nigel Chalk, says increased access to vaccination would save lives, prevent new variants from emerging, and hasten the recovery. In an interview with the Caribbean Media Corporation, Mr. Chalk said the next economic policy priorities are to support the recovery, create employment opportunities, and provide well-targeted spending on social protection, particularly for those hit most hard, lower-income groups, women, and the young. On the international scene, Moderna is touting the trial results of its COVID-19 vaccine for school-aged children. The pharmaceutical company says its trial showed smaller doses generated a strong immune response in children ages 6 to 11. More than 4,700 children participated. They were given 250 microgram doses of Moderna's vaccine 28 days apart, smaller than the 100 microgram dose given to adults. Moderna says the kids' antibody response kicked in 1 month after the second dose. The most common side effects included fatigue, headache, and fever. Moderna's trial has not been peer-reviewed or published yet. The company plans to submit its results to the U.S. Food and Drug Administration. And that's the top regional and international stories. I'm Sandy Williams.
We head now to a quick break. When we return, we'll have your Midday Sports Report. Simon Preston is standing by.
Welcome back. It's now time for Midday Sports. I'm Simon Preston. This just in, as the Inter-Secondary School Sports Association, ISSA, has received approval from the government of Jamaica to stage schoolboy football this season. ISSA are eyeing a November 12 or 13 start date for the Manning and Acosta Cup competitions. ISSA stated in a press release on Monday that it will be mandatory for all players and officials to take at least 1 dose of the COVID-19 vaccine before the competition. Head coach of the Reggae Girls, Hubert Busby, says he's hoping to have a camp in Jamaica next month to continue preparations ahead of the World Cup qualifiers. This follows Reggae Girls' 0-0 draw with Costa Rica in a friendly international in Fort Lauderdale on Sunday. The 2023 CONCACAF World Cup qualifiers are slated to kick off in February next year. And finally this afternoon, Jamaica's rugby league team battled to a 30-all draw with world number 9 Scotland in a test match in West Yorkshire on Sunday as the Reggae Warriors continued their build-up towards the Rugby League World Cup next year. Scrum half James Woodburn Hall was pleased of the tenacity of the Jamaican team.
It's a tale of two halves for me. We started really well, built a lot of pressure, and then we had unfortunately to have a sin bin and kind of gave the game away a bit. But I think we really want to bounce back after last week. In the second half, we just showed that true Jamaican spirit, that fight. Do you know what I mean? We're a little island. We fought so well in that second half, and I'm so proud of the boys to come back and get the draw.
Assistant coach Jermaine Coleman reflected on Jamaica's performance.
You know, we come out second half and we showed that commitment, that desire, that togetherness, that, you know, it's going to be the main thing that gets us through this World Cup journey. And, you know, it's the thing that sort of brings the community together is how we are as a team and how we are as a group. So that was massive. You know, actually what we did do at half time is talk about what we can control. Can we control our tackle? Can we control our finishes? Can we control our energy? And, you know, I think ultimately that showed in the second half that we started focusing on what we could control. And, you know, off the back of that, we probably should win the game, really. 6-5 to tries. I think Isaac, unluckily, with some kicks. But, you know, ultimately we take a moral victory from that.
The Rugby League World Cup is set to run from October 15 to November 19 in England next year. And that is it for your Midday Sports Report. I'm Simon Preston. Anthony, it is over to you.
Thank you very much, Simon. And that's the Midday News. I'm Anthony Lugg. Join us at 7 for Primetime News. On behalf of the news, sports and production teams, good afternoon.